Any stem cell transplant program is a very complex organization, and if we break it down, I think we can break it down into a few important pieces. One is the pre-transplant phase, where the patient comes to an individual physician at Vanderbilt, and that physician has to make a decision based on medical criteria: do we think we need a transplant? And the flow at Vanderbilt is, once that decision is made, the case is presented to the entire transplant team. We meet every Monday. And we all get together. This includes our search coordinators, our social workers, our financial counselors, our insurance coordinators, nurse practitioners, stem cell lab people. And then an informed decision is made by the physicians and all the ancillary support that we have that, yes, everything looks okay, let's move forward. And the care is then transferred to the transplant team. And we do a detailed transplant evaluation, which usually goes on for a couple of days. It's all in the outpatient. Wait for all the investigations to come back, and then make a final go, no-go decision. The transplant team then takes care of the patient for the first 100, 150 days in a donor transplant setting. If a patient is getting a related donor transplant, the donor also has to be seen in parallel. The donor is then collected, the stem cells are collected either with a traditional marrow harvest or a peripheral blood stem cell collection by apheresis nurses. The product is then transferred to the stem cell lab while the patient is getting his chemotherapy, and everything gets synchronized to the day of transplant. And from then on, the transplant team tackles the complications till around 100 days or so. And until early 2006, that's where the care was stopping, and the patients were then referred back to the original physician that they came to see at Vanderbilt. What we did notice is a lot of our patients come in from 3-4 hours away. And since we have become good at managing the first 100 days, we started seeing problems with transplants 6 months down the road, 9 months down the road, where we did not have a robust infrastructure. So we made an effort in January '06 to establish what we now call a long-term transplant clinic, where Dr. Kasim, myself, along with 2 nurse practitioners, we have multiple clinics a week, where as the patient is discharged from the transplant team, we take over. And we follow the patient until they're 2 years post-transplant now. And by that time, most of the immune complications have settled down. We revaccinate them, take care of all their internal medicine issues, high blood pressure, bad lipids, coronary artery disease, get them with the right people at Vanderbilt, and then we fade into the background. So it's a fairly complex organization, and in order to run any complex organization, you've got to have good communication. So we actually meet a couple of times a week. The entire outpatient transplant team meets, and we have very complex, sophisticated calendars and scheduling system, and we've actually got one dedicated person. So if one thing changes, 80 people get notified, because everybody has to be on the same page. So it's a machine with multiple moving parts where everybody needs to know what the other person's doing. And I think we do it well.